Fulbright and UMIX Academy presents the 4th UMIX course, Advanced Uniportal VATS and RATS course, directed by the experts thoracic surgeons Dr. Javier Gallego and Diego Gonzalez-Rivas. Lectures: 6 live surgeries cases from Lusiadas Hospital, directly from the OR to the auditorium. Wet lab in fresh cadaver model with the best technology to learn and practice real cases to teach the participants. Challenging cases, including uniportal robotic-assisted thoracic surgery, URATS. Fulbright, we think next.
We began 2 years ago here in Lisbon, some courses in the middle of the pandemic, and now this course is amazing because there are a lot of people around the world that they know about the Lisbon course, and they are coming here to Lisbon because this model of live surgeries in the first day and the cadaveric lab is a very good model to do a training, because all the participants can stay with us in the OR or looking in the auditorium, but it's very easy to speak, to talk with us and to share ideas. And in the second day, they are going to apply all the techniques they saw the day before.
The program of this international course means that it is now considered one of the most complete training in thoracic surgery in the world. Because in only 2 days, the participants have hands-on experiences with real-life cases from the OR, sharing the doctor's skills in real time during the live surgeries broadcasted to the auditorium, and even assisting in the surgeries. 6 live surgeries, including anatomic segmentectomies, subsegmentectomies, and lobectomies. Lectures about the most complicated cases in thoracic surgery and how to resolve them. New advances and improvements in uniportal thoracic surgery. The future is here. Uniportal robotic surgery, URATS.
Yeah, I'm here. It's fine. It was a great pleasure. Nice lectures, good operation, and yeah, it was great course.
And of course, the new technology. Fulbright always presents in this course its new advances. In this case, the new intelligent stapler, Lunar U.
This time we have our Lunar U stapler here, and it is more smart, automatic. With the screen, you can see the battery level, number of firings, the jaw situations, and it is completely powered from closing, opening, and firing. Well, one special thing is our curved tip is removable. It's very practical for thoracic surgery.
On the second day of this course, the participants have the opportunity to learn hand in hand with Drs. Diego Gonzalez-Rivas and Javier Gallego the correct steps to apply the Uniportal VATS technique. 5 tables in cadaver lab with the best instrumentation and technology to learn how to correctly approach the use of Lunar U staplers in the exact anatomy that the participants can find in real-life cases in their hospitals, makes this course one of the most complete in thoracic surgery in the world.
I would recommend this course for everyone because it has multiple parts and they're all interactive. It's what we need.
We are the Nova Center School, where the participants are doing uniportal VATS themselves by using the new technology of the stapling devices from Fulbright, the Lunar U, and they can try lobectomies, segmentectomies, and sleeve resections today.
I slip on the section.
Yes, rotate now. Okay, and rotate everything.
And you can bring new knowledge back home, and this is the way the whole specialty improves. So I'm really grateful being here, and I recommend to join this course.
4th UMIX course, Advanced Uniportal VATS and RATS course. Fulbright, we think next.